easiest one. We're going to treat every resident as though they are potentially infected with a bloodborne pathogen like HIV. So essentially, I've told my students this, you've heard this a bunch of times, but you just use common sense. If you have a cut on your hand and you're going in to provide care, put some gloves on. If they have a cut or if they have an open wound, go ahead and put gloves on. But essentially, we just need to treat this person as though they are potentially infected. But remember that the only way that we can get a bloodborne pathogen is through different body secretions or blood. So if we're doing pericare, like pee and poop, go ahead and put on gloves. You would do that anyway, right? So standard precautions is super, super easy. That one is going to be something that we use all the time, and we are also using standard precautions with enhanced precautions. So let's review that one next. Enhanced precautions. This one we are only going to be using when somebody has a disease or some sort of medical device that could potentially splash on us. And we only use enhanced precautions or specific PPE when we are doing the skill that works with that medical device. I'll give you a couple of examples. A wound. Somebody might have a diabetic wound on their lower extremity. If we need to change that dressing, we've got to put on a gown and gloves. Or how about we're doing catheter care where we're emptying out urine and we need to measure it. That could potentially splash on us. So we put on a gown and gloves. Let's go over that. Okay, Mrs. Leeton, I'm just going to empty out your catheter. Do you want that right now or in 5 minutes? Right now? Okay. I'm just going to get my stuff set up. I have a Chuck's pad that I'm going to lay down underneath your catheter right here. Okay, I'm going to get the graduated cylinder. The room has a urinal. I'm going to go ahead and use that. It has the measuring on the side, so I can use that. I'm going to get 2 alcohol swabs. As you can see, I've got everything set up to empty out my catheter. Now is when I go ahead and put on my gown and my gloves. Okay, then I can go ahead and bend down and empty out my catheter, being careful that I'm not contaminating the floor and my scrubs. So I don't want to put my knees on the floor. I don't want to put the back of my heels on my butt. We can use the barrier and put our knees on the barrier. That would be just fine. Just making sure that you're really careful not to contaminate your scrubs. I'm going to go ahead and wipe off the end of the blue tube with my alcohol wipe. And don't forget, you can always move your catheter bag wherever you need. So if this is hooked onto here and it's too close to the ground, go ahead and pick it up. That's okay to do that. I'm going to go ahead and empty out the catheter, making sure to get everything into the graduated cylinder. That blue tube is not touching the inside of the graduated cylinder or the inside of the urinal, whichever you're using. I'm going to reclip, wipe, put this glue back into the sheath. You can see the catheter is empty, and then you're going to go ahead and put it back on the frame of the bed. This we're going to measure. I'm going to set it off to the side on a barrier. We're going to go ahead and pick this up, but I'm not walking out of the room. I'm just going to set that off to the side. This is going to go in the garbage. All right, I haven't walked out of the room yet. I'm going to go ahead and doff my gown and gloves. Notice I'm right inside the room. I'm not going to leave with the gown and gloves on. All right, that's going to go in the garbage. I'm going to go ahead and take the gown off, preferably while we're standing. And then this is going to go into the garbage. Then I can sanitize my hands, take this and go out into the hallway. Then we can come back in and we can continue doing any extra care. That might include giving the resident the call bell, making sure their belongings are in reach, seeing if they need anything else. If at that time they say, oh, I need this or that, go ahead and get it. Nothing else requires that we put on our gown and gloves at this point, because enhanced precautions, we are only putting on the gown and gloves when we're working with the catheter.